Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everyone, and welcome to the AMA Steps Forward podcast episode for today. My name's Kevin Hopkins. I'm a family physician and senior physician advisor here at the AMA. On today's podcast, we're joined by Dr. Jerry Abraham. He's a family physician and director of Kedren Vaccines at Kedren Health in Los Angeles. Dr. Abraham is also president of the Los Angeles County Medical Association, a trustee of the California Medical Association, and vice chair of the AMA Council on Constitution and Bylaws. Dr. Abraham, thanks for being with us today.
Thank you so much for having me.
Could you tell us a little bit about your personal and professional background and help us to find out a little bit more about you?
Sure, absolutely. Thank you so much for having me, Dr. Hopkins. It's a real pleasure to be here. My name is Jerry Abraham. And yes, I'm a family physician, but also an epidemiologist and medical quality specialist. I work at Kedren Community Health Center, which is a historically Black institution and federally qualified health center and acute psychiatric hospital located in South LA, and also serve on the faculty of Charles Drew University, a historically Black medical school, the fifth in the nation, located here in LA. Throughout the pandemic, we really had to figure out how to get into the communities and provide care, including vaccinations. But what we've learned is that we also need to address other public health emergencies similarly, especially because they disproportionately impact communities of color and communities that are disadvantaged. And so therefore, that really is the impetus for what my team, the institutions I work with, to really engage on this issue, specifically around the health harms related to climate change.
Excellent. I'm glad you shared a little bit about the background of the organization for which you work. I was doing a little bit of reading, and Kedren Health is an integrated medical and behavioral health services provider that was founded, it sounds like, in 1965. So it's been around a long time, with the vision to help eliminate health disparities in South Los Angeles. Certainly a very noble cause and mission. How long have you been with this organization, Jerry?
So I'm fairly early career. I am actually a member of the AMA Young Physician section. So graduated residency in 2017 and fellowship in 2018 and joined Kedren in 2019, literally months before COVID-19, the national emergency declaration was made. So fairly new to the organization, but really brought all the training from medical school, residency, fellowship, and just all the preparation we do. And it was exactly what we needed at the time when COVID hit. And that was really our claim to fame, was really centering equity and justice in how we provided services throughout COVID-19, ensuring that our communities were not left behind, particularly when it came to equitable vaccine distribution. And so it really is a reminder, again, all that preparation really comes in handy. And when that moment you are called, we are ready to step up. And that's exactly what I did. But I've only been here really since 2019. Seems like yesterday.
It sounds like Kedren was founded really in the wake of the Watts riots of 1965 and really has been a long-standing beacon of hope in that part of Los Angeles, continuing to battle and fight for more equitable healthcare and healthcare access for people of color. What a great mission. I also know that you joined the second cohort of the Medical Justice in Advocacy Fellowship, which, for those who aren't aware, it's an education initiative of the AMA and the Satcher Health Leadership Institute, named after our previous Surgeon General, David Satcher. This is at Morehouse School of Medicine. What sparked your interest in that fellowship program, and what did you hope to get out of it?
Yeah, absolutely. These programs are really what empower us, equip us with those skill sets. So when met with that moment, those opportunities, physicians can lead. And that's exactly what this AMA and Morehouse School of Medicine, Satcher Health Leadership Institute, Medical Justice and Advocacy Fellowship is all about. I'm a part of the second cohort going through this program. It's an amazing partnership between a historically Black medical school and our American Medical Association. We've taken many steps as our AMA to really advance health equity and to address medical justice, including addressing the harms of racism and taking steps forward. The AMA also created a Center for Health Equity. All of this work really stems from those intentional efforts made by AMA members and leadership. And that's really how we get to this program where we bring together, honestly, very talented, often early or mid career individuals who are passionate about whether it's a project or addressing a specific disparity to advance health equity and medical justice agenda. And that really is about increasing access to care, providing coverage to all, addressing those and closing those health disparities that affect many of us, many of our communities, particularly affecting our patients. And so that is really what's exciting about this. We come from all over the country, from all different specialties. We are a makeup of various races, ethnicities, genders, identities, and we really are able to come together and find unity and collaboration, even though we're all working on very different projects and really have different lenses. But really, it's that partnership, that getting to know one another, that cohort that we're able to really bounce ideas off of one another, refine our projects, really be able to make that difference, the best possible outcome for the work that we're doing. And I think as a result, we'll all go on from these programs, particularly my cohort will leave this particular fellowship. And I look forward to seeing all the amazing things each one of my fellow cohort members will accomplish as a result of being a part of the fellowship.
It sounds like such a intellectually stimulating environment and group to be a part of. Are you able to share, maybe some specific examples of how your participation and engagement with this fellowship program really helped prepare you for the work that you're currently doing to advance equity in your day-to-day practice and your work with policymakers?
Yeah, absolutely. I'll just start by saying, Dr. Hopkins, that what's really neat about this fellowship is that it's bringing together people that are really passionate, but it's not only passionate, but people that really are in some ways becoming experts in their field, in their area. And I think that's really important to know that we're coming from a starting place that's not at the beginning, but rather we've done some homework, we've made some progress. And in my case, it was really how do we bring equity during times of public health emergencies like the pandemic that we had with COVID-19. And so really understanding what are we bringing, what are our strengths, our talents, our passions, but then what more do we need to gain? What skill sets, talents do I need? What technical expertise do I need to gain to really continue this work in equity and justice, whether it's equitable vaccine distribution or addressing other public health emergencies in South Los Angeles or in California or even in this nation, whether it's reducing gun violence, addressing Black and Latina maternal mortality, whether it's addressing a whole host of public health issues, including the health harms of climate change. I've really been able to bring the passion for public health all together with that lens on equity and justice, and now go back to that work and really take several steps forward, honestly. And I really hope that this continues to be my passion project. Really, it's a lot of what motivates and fuels me in the clinical space when we're in the exam room, when we're engaging our patients. It's also so important to know what we as physicians are able to do outside of the exam room, what we're able to do in the public square. We saw through the pandemic how much people respect and truly value the perspective, the voice, the expertise physicians bring. And so we need to stewardship that well, especially in areas where trust is needed now more than ever. When it comes to, for example, climate science, physicians and health professionals really bring a trusted voice. And given that, for example, climate change disproportionately affects communities of color and lower socioeconomic status communities, it's really important that there's buy-in from all stakeholders within the nation and beyond to really address an existential crisis. But the hope, the faith that I have is we were able to make it out of this pandemic all together, honestly, as one world. And I believe that's what it's going to take to really address climate change and other public health emergencies. So I have a lot of faith we're going to be able to move the dial, make progress, and find a solution that really improves the health of all people.
One of the very valuable changes that has occurred to help shine a light on health inequity and disparity is the advent of the social determinants of health and the role that they play in providing health care to our patients every day. I think we've all inherently and probably intuitively recognized for years that environment plays a big role in your overall health. How have you been able to connect the dots, or what has research told us that allows us to connect the dots between climate change and social determinants of health in the communities in which you care for patients?
Sure, absolutely. And I'm just going to take a couple of steps back for a second just to explain. It was during the pandemic that we realized that we have to address social determinants if we're really going to improve health, especially during an emergency. And so we saw there were so many barriers to getting vaccinated for people across this country, whether it was transportation, paid time off, childcare, elder care, you name it. Our patients may be working 2, 3 jobs to keep a roof over their head, to put food on the table. And on top of that, we're asking them to roll up their sleeves and get a shot. And that was really important to break that down and understand those barriers. And for us, that really meant needing to leave the sterile 4 walls of clinics and hospitals and go out into the community where people live, work, worship, play, where they go to school, and to ensure we're able to provide care to those that are homebound and people experiencing homelessness. And that really is the evolution of my street medicine program that came out of the pandemic. Once we started going out into the world and providing vaccines in the community, in churches, houses of worship, schools, factories, public housing developments, we really saw that this was a new opportunity. We're now putting roots in the ground and establishing trust in an era and with history and lived experiences where there is mistrust and distrust in the medical system. And rightfully so, given the history, whether it's the Tuskegee trials, the abuse of Henrietta Lacks cells, the sterilization of Latinas and African American women in our county hospital in Los Angeles. There are so many examples why people would not want to roll up their sleeves and get a vaccine. It's similar for things like climate science. Why should I trust you? What have you ever done to prove to me that you actually have my best interest at heart? And those are the types of things that we really have to tackle head on before we can even make any progress to address even those other barriers that you mentioned, really related to those social determinants of health, all of those environmental factors as well. And so once we established that trust, we could really engage in those conversations around why your children, for example, may have more asthma exacerbations. It may be because you live closer to a highway, and that may be a result of history and racist policies, including redlining, for example, that affected Black and Latino families, forcing them to live in more industrial parts of town, closer to major arteries, roadways within our areas. Many of our patients may not afford, for example, air conditioning. They may have to keep their windows open. You can imagine when we think about things like particulate matter, when we think about what is in the air we breathe and the various gases as a result of emissions, and ultimately a lot of it coming down to our reliance on fossil fuels. These are all interconnected and related. And so you see, as I'm weaving this story and building trust and addressing these real issues in a way that we can talk not only to the patients, but to policymakers and to our colleagues and other health professionals, we're really able to move the dial. And then we have the political will from not only the public, but also from the policy-making class in order to address barriers that are systemic, that are structural, that keep people ultimately, what I believe, from living their best life, healthiest life, highest quality life. And I think that really is our mandate as physicians, this profession, the oath we take to really care for our patients and the public.
Thank you for that. You mentioned a few things relevant to climate change and social determinants of health. Certainly, air quality is a big one. And even those of us that don't live in a crowded, congested urban area don't have to go back too far to think about this. Even like this summer, the wildfires in Canada and how that affected large swaths of the upper Midwest with poor air quality, and it affected people's respiratory diseases, chronic respiratory diseases, and those types of things. It's not hard to see the connection between environment and health. Are there any other specific connections that you've been able to identify around climate change or climate science and how it affects social determinants of health for subsets of patients?
Yeah, absolutely. And just wanted to return it really quickly to the fellowship program. What's really important about the fellowship, I mentioned the word structure, I mentioned the words systemic, right? The fellowship between the AMA and the Satcher Leadership Health Institute really provides us fellows structure. I call it a canvas on which we can create these masterpieces. It really provided protected time in which I could dedicate and devote in understanding these issues, not only how air quality affects asthma exacerbations, for example, but also how there are links between climate change and my patient's risk for excessive heat exhaustion. Imagine migrant workers who are working outside in the Central Valley of California and the risk and the harms that they're exposed to, and really the sequelae as a result of that. Even economic harms to that family member if that person is ill or not able to work anymore. We see lots of examples where, as a result of climate change, we have direct increases in cardiovascular risks, increases in risk for diabetes and hypertension. There's also a huge mental health burden that affects people as we become climate refugees. We are uprooted. We are having to flee from floods and fires and extreme heat. And this really is a global problem, but there's a lot that we can do locally right here, right now. And so this fellowship really allowed me a chance to dig deeper. And honestly, I never learned about a lot of these things in medical school or in residency or fellowship. And so really having some time to devote to understand climate science, to really step outside of my quote unquote lane as a physician and really start engaging with engineers, policymakers, those who may have a different perspective. I think for me, especially being someone who's born and raised in urban environments, work there, work in the safety net, I always felt that the climate movement really was about electric vehicles and tax write-offs for wealthy people, tree hugging and saving polar bears. And I think for us, it often felt like, what does that really mean for any of us who are just trying to put food on the table, keep our housing, really just trying to make it through the day? I teach residents and students regularly, and I remind them about Maslow's hierarchy. And so if we don't have the basics, how are we supposed to expect you to care about these much bigger threats? And so it's something that really you think about. It's front and center, especially since my program is centered around caring for people experiencing homelessness and housing insecurity. It's really hard to connect all those dots, and yet I need to. And what this fellowship really allowed me to do was better understand how climate change, particularly the health harms, have direct impacts in further exacerbating disparities. And if we don't address these issues, we really truly can't advance health equity and medical justice. And so that is really an important thing that came out of the time, really, the devotion. It was like studying, honestly. I felt like I was in school again. And, as I reminded, I think we'd spoken to several people at the AMA about this experience. And it really is like a think tank. It felt like an opportunity to go, quote unquote, to Washington and to really sit there and think and to really bounce ideas with other experts. And those experts were other physicians who were in the fellowship program. And we were able to fine tune, refine our programs, think about metrics, ways to measure outcomes of our projects. For example, could street medicine move the dial on helping address some of the climate change issues? Something else that I'll just leave out there that I think is important for health professionals who are hearing this to know, there really is a framework to address the health harms of climate change. And that really is by addressing adaptation, mitigation, the role we play in patient and community education and engagement, and then applying that lens on equity and justice. When we think about adaptation, that really is about how we're going to be better prepared for medical evacuations. What role will we play during disasters, and how can we prepare now for them? We are essential public health infrastructure as physicians, as health professionals, and we need to really own that and find better ways to deliver. I'll also say mitigation is critical. What can we do right now to reduce those harms that are further exacerbating the problem? We know that we don't have time to waste and that we must contain the warming of the planet to 1.5 degrees Celsius, that of the pre-industrial era. And we are exceeding that, and we're getting close to that midnight clock that is ticking that you hear about on the news. You see it in the Lancet countdown. You see it in the New England Journal of Medicine when 200 journals came together to declare this emergency. You saw it in the AMA resolution that I helped co-author, and we passed in the House of Delegates, where the AMA did declare climate change a public health crisis. And so the momentum is really there. And you hear it in the way I'm speaking about it. It is because of the fellowship that I have this understanding, that I better understand what does the word particulate matter or volatile organic compounds mean, or really what are the targets 1.5 degrees Celsius? What does that look like? How do we achieve a zero carbon economy by 2050? Can we get to half of that by 2030? What are governments doing around the world to address these issues? And also, what are the impacts? There have to be immediate benefits. And by measuring that right now, we see that people's asthma exacerbations are reduced. We can reduce hospitalizations, morbidity, mortality due to all sorts of diseases that are affected by climate change. And so I'm really excited. You hear the passion. You see how empowered I feel as a result of being able to equip myself with very important information that helps advance the work that ultimately gets us to that North Star for me, which is health equity and medical justice.
You mentioned the framework, adaptation, mitigation. Would that be the most valuable thing as far as pearls of wisdom that you can share with physicians out there who might want to get involved in this type of health equity work?
I would definitely say that we have such a powerful, sacred space, and that is that exam room, and it is a physician-patient relationship. Just the other day, one of my last patients at the homeless shelter was really at the end of the road. I didn't have a lot to offer, and I definitely don't have the answers for this person's future. And the circumstances are devastating, including severe mental illness, substance use, and homelessness. But what I could offer was that conversation. I heard their concerns. I took time, I listened, and I provided a space that built so much trust and regained this person's trust in us, that we really are here not only as navigators, but partners in improving your health, improving your outcomes. And all I could offer in that moment as we ended was truly the biggest hug I could. And I knew there is, and this is hard to hear sometimes, a stench related with homelessness, right? For living out there exposed to the elements. And I knew that hugging him may mean for the rest of the day, I will have that on me. But if that means that he lives, honestly, to see another day and sees reason to put one foot in front of the other and keep going, there is absolutely no way I was going to refuse him that. And to see him cry and break down, and to believe that no one else cared for him in this world, but now maybe people do, maybe my doctor does. And to see him leave the shelter that day with his head held high, even though he doesn't have all the answers and neither do I, that is really what we're able to do. That's just one story, one interaction. Imagine all the countless interactions we have with patients every day, how much trust, how much power there is there. And if we use it for good, we can really accomplish so many great things. Never squash that opportunity that you have with your patients. Never stop advocating and doing what is right as physicians. That's very important too. And then lastly, I'll just say, we're lifelong learners and that we're all in this together. And there really is a lot of hope when we come together. And I think that also will help us with another public health emergency we see, which is clinician well-being. And I think by really coming together on issues, existential threats, COVID-19, climate change, we'll have a stronger profession, a stronger public and society, and it'll be a sustainable one for many years to come.
Yeah, absolutely. I hear the passion in your voice, and thank you for the valuable work that you're doing that affects not only the patients in southern Los Angeles, but patients throughout our country and really around the world. Thanks so much, Dr. Abraham, for joining us and for sharing your passion for this topic.
Thank you so much, Dr. Hopkins.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.